Today we are going to discuss about the allopurinol, which belong to the class of medication known as xanthine oxidase inhibitors. Xanthine oxidase inhibitor is any substance that inhibits the activity of xanthine oxidase, an enzyme involved in purine metabolism in human. So further use of about the allopurinol uses. Actually, allopurinol medication is used to decrease the high blood uric acid levels. Now, high blood uric acid levels, for example, which is the normal value in female, up to 6 milligram per deciliter, for men 7 milligram per deciliter, and 5.5 milligram per deciliter for youth under 18 years old, which is the high uric acid level in blood is also known as hyperuricemia. The other specific used of allopurinol, which is used to prevent gout. Gout is also inflammatory arthritis characterized by recurrent attacks of the red, tender heart, and swollen joints. The other use of allopurinol is prevent specific types of kidney stones and for the high uric acid levels that can occur with chemotherapy. Actually, allopurinol, which is can be used by mouth or injected into the veins. The daily maximum dose of the allopurinol is zero point 0.4 gram by mouth or injection. Routes of uses, it is mainly used by mouth in tablet form or in IV formulation intravenously. Further, it is used. The typical dose for tablet to be taken maximum daily 100 to 900 milligram per day. To some of the side effects are which are associated with the allopurinol, itchiness, rash, vomiting, kidney problems are the some common side effects which are associated with allopurinol. Some of the drug interaction, the common medicine which should not be used with allopurinol, for example, cyclosporine. It is the common anticoagulants, for example, warfarin. Other one, phenytoin, theophylline, cyclophosphamide. Another one, salicylates, because this medicine increase the secretion of uric acid. Other one, ampicillin and amoxicillin, diuretics, especially thiazide, and the other medicine which should not be used with the allopurinol include angiotensin converting enzyme inhibitors. This should not be used with allopurinol.